Let's get reaction from Dr. Robert Redfield, former director of the Centers for Disease Control and Prevention. Nice to see you again, Doctor. Welcome back.
Yeah, thanks for having me.
First, your reaction to this announcement from the White House just a little while ago.
You know, I think it's an important announcement. I mean, clearly there's a commitment that the president and RFK have had to try to get a better understanding of autism, which has clearly grown substantially in its occurrence in individuals in our country. And I think they've looked at the data. You know, there was a paper that came out in August of this year that basically looked at over 40 studies that suggested that there appeared to be an association between Tylenol use and pregnancy. It doesn't prove causation, but it does suggest an association. And I think they thought it was important to bring that to the American public so they could have that information and make decisions about what they do during pregnancy.
Autism was first defined back in 1911. Tylenol hit the market decades later. I believe it was in 1955. Why are we seeing higher rates now? Is it simply because there's more screening and there's better screenings for children with autism?
I think it suggests that there's actually environmental factors. I mean, there's multiple factors that are probably leading to autism. As Jay Bhattacharya, the head of NIH, announced that they're about to award, I think, 13 grants to different scientists around the country about different ideas that they have that may cause autism, in addition to the announcement that we had today. Clearly, the previous approach that thought maybe this was genetic really didn't seem rational when you saw the increase of cases, you know, going from 1 to 1,000, 1 to 5, you know, 1 to 100, you know, 1 to 30, that it's probably not genetic. It probably is environmentally, and there's probably multiple different causes of this, of which it's been proposed that this is one, and this folate deficiency may contribute to it. So I think the most exciting thing about today was they also acknowledged that there may be a therapeutic intervention that some of these mothers can try that may benefit their children.
Yeah, I'm sure that's a relief for so many parents out there. With that said, pregnant women are getting mixed messages here. The American College of Obstetricians and Gynecologists, they're pushing back. They're saying Tylenol remains a safe option for pain relief for pregnant women. I wanted to hear your response to that.
Yeah, I think it's unfortunate. There is a tendency in medicine for people sometimes to be willing to step back from recommendations they made in the past and where they may have been incorrect. I think the conservative approach at this, in light of the data that we have today, is that that Tylenol should be not try to be used in pregnancy. And I think the president had it right when he said, if you have to use it, use as little and as you can, and for as short as you can, and get doctors involved in this, because I think it's unfortunate that certain societies just want to dismiss this and say, well, wait, we couldn't be wrong. We didn't make any mistakes. Tylenol's fine. Let's just move on.
Dr. Redfield, I am curious, why make this announcement now when lawsuits over this very issue have been dismissed and there has been data that doesn't link Tylenol or acetaminophen to autism?
Well, there have been data. As you mentioned, there's a study that came out in 2024 that was among twins that did not show an association. But then there's now a new study in August of 2025 that does strongly suggest there is an association. So I think it's part of transparency. I'm happy to see HHS and our government, when they have new information, actually put it out to the public, so that the public can evaluate whether it means to them, rather than somehow feel that they have to be the secret arbiters of this data until when and what they want to let it out. So I think it's just Kennedy's committed, and I do still think that Kennedy is going to be one of the most consequential secretaries of health that our nation's ever had, and I do think for the good. I think Kennedy's committed to trying to get a better understanding of what's causing autism. I don't think he has any predisposed knowledge of what it is, and I think that's why he's asked NIH to put out what they're going to announce. I think in a week or so, the 13 different grants to go after different potential causes, and our scientific firepower is going to focus on trying to get a better understanding. We're not going to stop at the Tylenol. There's probably multiple other causes that are leading to autism, and let's figure them out.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.